Welcome everyone to today's webinar, The Future of Nursing, Mercy's Roadmap for Redesigning the Workforce. My name is Jacob Emerson. I'm with Becker's Healthcare. Thank you all so much for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser first. You can also submit any technical questions into the Q&A box. We're here to help at any time. With that, I'm very pleased to welcome Betty Jo Rocchio, who is the Senior Vice President and Chief Nursing Officer at Mercy Health System, and Dani Bowie, who is the Vice President of Clinical Strategy and Transformation at Trusted Health. Thank you both so much for being here today with us to discuss the future of our nursing workforce. Dani, I'll turn the floor over to you.
Great, thank you. Well, for today's presentation, we will review current nursing workforce trends driving the staffing shortage, how Mercy addressed the nurse staffing shortage, nurse-first approach to improve patient, clinician, and hospital outcomes, and review relevant recommendations and next steps healthcare innovators can take to address the nurse staffing shortage at their health system. Now more than ever, we're living in a talent-centric world. In fact, that's exactly what the Great Reshuffle revealed. Nurses sit in the driver's seat with a new set of expectations around flexibility and autonomy regarding desired jobs, and many health systems are scrambling to meet those new expectations. Unfortunately, the ability to build flexibility into nursing workforce programs is a lot easier said than done, due to the complexity of the practice environment and the limited tools and technologies nurse managers have access to accomplish this important work. The nursing workforce is in a crisis with the projected shortages on the horizon. This is in addition to the historic rise of nurse turnover over this last year, which is at an all-time high of 27% for U.S. hospitals. This unfortunate trend has led to excessive use of contract labor, increased incentive spend, blown operating budgets, and overall burnout of the nursing workforce. According to a recent Trusted Health survey, nearly 71% of the nurses said their experience as a nurse would improve if they had more control over their schedule. And 52% said that the way scheduling is currently done lowers their job satisfaction. If we can't find new ways to connect with nurses, they will move on. The American Nurse Foundation also conducted a survey over 11,000 nurses in 2022. And findings revealed that 23% of respondents plan to leave their current role in the next 6 months, and 55% of those intending to leave cited insufficient staffing as the top reason. Hiring is only one strategy. To take these challenges head on, health systems need to use multiple approaches to attract and retain talent to meet their expectation for staffing flexibility. I'm going to hand the presentation over to my colleague and accomplished nurse executive, Dr. Betty Jo, to walk us through how she led innovative and transformational change for her health system, Mercy, to show us how she addressed these challenges and is moving the needle to create a nurse-first centered approach around flexibility that will also support the frontline manager.
Thank you, Dani, for that very nice introduction. Appreciate it. We are going to be walking through some slides today. I just want to lay the groundwork for what this might look like moving forward in the future. We're going to talk about today the why we wanted to do it, which Dani laid out very nicely for us. The on today to take that nurse-centered approach, and the how we did it in Mercy Health, and the results that we're seeing. While they're early results, we have had some pretty great results moving forward in the future. So let's talk a little bit about Mercy and who we are before we get started. So while Mercy has a great reputation for providing great patient care, one of the other hallmarks of Mercy is that we have an Office of Transformation and an incredible backbone for delivering a digital eco footprint. And that allows us to dream beyond imagination for how we solve our most important problems. You will notice that on the slide that we are one of the largest 25 health systems. We do serve millions annually, but the other advantage is we're highly integrated. We are a multi-state healthcare system. We have 40 acute care hospitals and another 5 specialty hospitals, heart, children's, orthopedic, and rehab. What we're going to hear about today really covers all of that wide expanse as we were dreaming on what the future might look like. We are in Arkansas, Kansas, Missouri, and Oklahoma. We also have clinic and outpatient services in Arkansas, Louisiana, Mississippi, and Texas. So we are that Midwestern large health system. So let's talk a little bit about what we have done and how we got there. So the vision and strategy started about 2 years ago in Mercy. And so we recognized early that this nursing shortage across the country wasn't getting any better. And so we all know that if you want different results, you have to design your way to a better future. And so what did we do? We got our nursing teams together and laid out a vision and strategy and started executing against it. With a redesigned process and clinician-centric technology strategy, we ultimately wanted to take a look at how we could maximize our retention, increase our fill rates, reduce labor spend, and maintain that best-in-class quality and patient outcomes that we were used to. So what did we turn to? We used what we had internally, which was that bias towards a nurse-first, tech-driven approach to engaging a multi-generational workforce. And to do that, we went out and searched the evidence, found best practice, and one of those things that were produced out of this was we needed a technology partner to be able to get us there. So our solution focused on a flexible, scalable enterprise model across all 45 hospitals that had the components of delivering a healthy work environment for our clinicians at the bedside. The second was we wanted transparent pay practices. Otherwise, we can't reduce our labor spend. The third thing was we wanted a great user experience through a mobile-first approach. When we looked at the generational workforce literature, we found that using an app and meeting our multi-generational workforce where they were today is going to be key in driving that fill rate. So let's take a look at where we started on the vision and strategy. So jumping into a tech-enabled approach without having good process and taking a look at where you're heading will surely get you there quicker with technology, but you may not always land where you want to be. So the nursing leaders and myself had a goal of reducing the reliance on agency nurses and making sure that we were filling our rates with the addition of our gig coworkers into a regional float pool or hub model. So we designed our workforce layers in 3 ways. We really started splitting out the workforce strategy. And you'll see the 3 layers on the screen, but it's around core, which was our full-time coworkers, our part-time coworkers, and a part-time flex, which we'll talk about here in a minute. Our flex was our local float pool, our regional float pool, and this new gig per diem that was really going to take technology to be able to lift it off the ground. And then you'll see up top our agency, which is external agency and an internal agency strategy to allow us to be able to fill in when the other 2 layers weren't meeting our needs. So here's been our journey to date. When we took a look at using that workforce strategy, we realized that we had a couple of competitive advantages. We already had an automated staffing and scheduling system that all of our nurse managers across the enterprise were using. Number 2, we partnered with Trusted Health early on during the pandemic to get an automated system to manage nurse credentialing. And those of you who have HR systems out there, they do a fairly good job of managing that nurse credentialing and where they are. But what we were lacking was a true system that managed all of our workforce layers. It's not just managing internal coworkers, but it's going across and saying for each of the workforce layers, we want to manage each layer in an automated system to be able to provide the flexibility that we needed to call upon all of those nurses in the right way to be able to increase our fill rates and reduce our labor spend. We're going to talk a little bit more about that here in a minute. The third one, which has been, in my estimation, the game changer, is a mobile application for available shifts. And we are going to talk a little bit more about that mobile app since it's such a big part of the strategy. Number one, we started with a pilot to full expansion heading in the future to 9,000 users in 2 years. We looked at that multi-generational offerings to gauge the full workforce. What does it look like? Built out in a technology platform. And we launched back on May 27th of this year, an enterprise strategy for the gig workforce in nursing. While we started back in October with a little pilot that we're going to talk about here in a minute, really that big launch on May 27th was really the big lift, not only in terms of process, but in terms of technology. All right, let's dive in a little bit to what it looks like for us today. So we really talked about powering our gig ecosystem that we were creating with a mobile app. And so we realized if we push this out to a gig workforce beyond our walls of Mercy, that our internal coworkers might like that same experience. And when you take a look at it, we are using this app in 2 ways today to meet all of our unmet staffing needs. Number one, we're pushing it out to Mercy core nursing coworkers in that very bottom layer for all of their incentive shifts, their overtime, incentive shifts, anything other than the regular schedule goes out through an app. Number two, we're using this app in that gig per diem or gig coworker lane as well, that flex layer up. We're using it for regional float pool. We're using it for gig. And so it's really powered that whole flexible layer, which makes sense because an app is way more flexible than logging into a desktop trying to pick up shifts. We're going to talk a little bit more about that functionality as we get into the presentation. I did want to level set here for a quick minute. In that core coworker layer, what you saw was something called a part-time flex. And I wanted just to give a little definition around that because it's a new role that we launched in Mercy, and it is also helping us get there. They are really part-time coworkers that have predictable, regularly scheduled, non-traditional shifts. For example, they are not a PRN. They are between a 0.1 and a 0.8 FTE, and they require that flexible schedule in hours. For example, you may have a mother or father that need to be home in the morning or in the evening, and they can work kind of that mid-shift type of design. And so we require that they work it regularly in a regular schedule, but the hours are very flexible around their family needs. They do report to a manager on their home unit, so they do have a home. But the only thing that we're offering in this layer, which has been quite attractive, has been that flexible hour coverage. The second definition I wanted to talk about today is when we talk about gig coworkers, what exactly are we talking about? You hear a lot about it in the literature outside of nursing. Nursing is starting to pick it up. I've seen it in several of our publications recently, but there's not been a definition, and certainly not a definition around execution. So that gig coworkers expands our nursing workforce, and they bring that help to the bedside. It is an unpredictable labor source, so you have to be ready for the change management around that. But they are nurses that are interested in occasional shifts. They have 0 FTE. But what I will tell you is the game changer has been hiring them as Mercy coworkers. They have the same qualifications, hiring processes, competencies, and interview fit requirements of any of our Mercy nurses. So for all intents and purposes, they have all the core components of a Mercy nurse, but they are only interested in working when they have time. They do use that mobile app to pick up shifts. They have a max of 30 hours a week and with a minimum of 1 shift every 90 days. Now, for those nurse executives or leaders out there, this is a brand new concept to be totally flexible with how you engage that outside talent pool into your organization. It does take some change management around it. We have a full-blown organizational effectiveness talent management plan and implementation plan around this because they don't have the weekends, the nights type of requirements or holidays that other nurses do. So how do we get engagement from our core nurses to be able to accept this flexible layer? It's not that they're not picking up the nights and weekends and holidays. It's that we're using incentives through an app-based application to drive them to our areas of greatest need. So somebody said the other day, it's more of a thinking around a carrot and stick approach. We require our core coworkers to take on so many holidays and weekends. We incentivize with that carrot, if you will, our gig flexible staff to pick it up through putting our money where we need to drive that workforce. It's a completely different way of thinking, but without getting on board with that, you likely could end up making a lot of mistakes in this layer. They do report to our float pool, so our managers aren't burdened with keeping track of this flexible workforce, but they do have a flat rate of pay, and then we put that incentive shift on top of it to get them into the spots where we need them most. All right, let's take a look at how we've really developed this workforce. And today, Smart Square is our staffing and scheduling system, and the app replaces that for picking up additional shifts, 100%. So you can see, I love this visual. We move from desktop to maybe a little more mobile version on an iPad or a flexible device. And now we have moved into using the app on our phones. And so every nurse that is credentialed in that system that we talked about is eligible after they meet competency, all the hiring requirements. They are pushed out this app into the gig layer, but internally, everybody has access to being able to pick up the shifts that they're credentialed for. They are also managed in that same system. So we have one system of record. We call it Mercy Works on Demand. It is powered by Trusted. It is owned by us on the side of our coworkers, and we collaborate and partner on that gig nursing workforce and what that looks like. But every nurse who touches a patient in Mercy is on Mercy Works in Demand. They're credentialed. We know where they can work, and we interface that with our app to be able to push out shifts in both ways. All right, so what does the app look like? This is, we call it Mercy Works on Demand, which has those two components of the technology that we talked about, which is an app based for the frontline user and that Mercy Works on Demand platform that has every nurse in it. Those are the two essential pieces that we're going to be talking about here. So let's take a look at what this looks like at the front lines. So we have a hiring manager, Kate, who's on one of our units at Mercy. And let's take a look at what happens. So nurses in Mercy generally have a cutoff time on when they can call off. And it's usually right around 4:30 in the morning. Pre this technology, Kate would have to check in with her charge nurse to make sure that she had all shifts covered before arriving at 8 a.m. So that puts her up very early in the morning and sometimes working late at night to get the next day covered. Today, somebody just calls off. The charge nurse or our staffing office put it in our Mercy Works on Demand system, and that goes back into Smart Square. And it automatically launches, pushing out in this order to our available coworkers in the Mercy Works on Demand platform. We have on-unit staff. We have a nearby unit, right, that might be able to stay or pick up additional, right, that are credentialed to do it. They can pick up an incentive shift. The third thing that happens is it's pushed out external to our entire gig nursing workforce. And then we have external PRN that are direct source that could help on the unit. In any case, the app takes care of all of it, and it's through an automated process of simply logging into our base system and saying that we had a call off. I can't tell you the number of hours and time that has saved our nurse managers from having to manage this manually. And if there's any nurse managers out there, you know the hassle of trying to find staffing the day before and picking up the phone and calling. Today, there are no phone calls made. It is all done through the app, which has seemed to have driven a much better user experience and an increased fill rate, which we're going to talk about results here in a minute. All right, let's dive into the app a little bit. So why is the app so magnificent? Because it is structured like any other application that our workforce is using today. It has, number one, a seamless sign-in. We call it Mercy single sign-on. So there's not an increased burden of signing into the app for our frontline coworkers. It has intelligent notifications. And what we mean by that is our gig workforce, as well as our internal workforce, never miss an opportunity to see either an incentivized shift or a shift that's open. It is automatically pushed to them and they get a notification. Number three, they're able to personalize their preferences. So you can see here on the PowerPoint that they can actually personalize their app as soon as they get started in working with us. They can say, hey, I have a fixed schedule in a hospital across the street, but I want to pick up all my extra shifts with you. And I prefer to work on Mondays, Fridays, Saturdays, Sundays, whatever fits their schedule. And they can click that in the app, and the app will prioritize sending them their preferences, just like most other apps do in the background. The other thing that's fantastic that's coming is an automation component that uses artificial intelligence to be able to tell us, right, that Nurse Dani, not only did she select that she prefers certain days, but she's actually picking up a good bit of the weekends as well. So we're going to prioritize with that data in the background that we have to push the shifts that we know that Dani has been selecting in addition to her preferences. And so we're getting more pickup on shifts and increased fill rate with that intelligence in the background. The fourth thing is they can browse open shifts. So they can scroll through the app. We're going to take a look at this here in a minute, but they can scroll through that app and find really anything they want as long as they're credentialed for it. And then they can view the details right in the app, right? I love it. It says we need somebody today at 9 o'clock. It is going to be a 12-hour shift. It's a float shift where it's located, which is one of our hospitals at Mercy Springfield, and it literally lists the incentive amount. Now, the incentive amount changes based on time of day, fill rate, those type of things. So it's a great way to take a look how we're personalizing this app as well as getting that increased pickup. All right, I did want to cover something here that it gets into the background of what are the finances or what's the thinking behind the compensation strategy for this. So when you take a look at it here, you can see on that mobile app, that internal base, right, that we're talking about shift popularity, shift preferences, that engagement of that coworker that's picking them up, what the notifications look like, the transparency of the payout. So they know exactly what they're going to make before they pick up the shift, right? We know the cost depending on their work experience and what shift they make up. So when you take a look at this, there's two ways to look at this. There's a fixed rate, which is base, right, for our internal coworkers. And then there is an incentive that we place on the shift that's based on really the need we have, right? And the great thing is the strategy behind this is the further out that the internal coworker picks up the shift, the actual more money they see. So we're incentivizing them to go ahead and pick up shifts in the immediate until it comes to kind of that day of. And then if somebody calls off or something, it does fire a higher incentive. And then, of course, if it's a coworker that, qualifies for overtime, it pays that overtime as well. And there's a variable component there and a fixed component that we keep very separate to drive that fill rate. So let's talk about what it looks like if you go to that external source, which we're talking really about, external agency or internal agency. we do have the same thing, qualifications, shift preferences. We do have that engagement, but there's just a contracted rate that's fixed per shift, really. And so that base rate is fixed. It's what we've contracted for. And that's the difference, right? Those incentive and overtime allow us to play with it a little bit and move people in the direction where we actually need the help. And the nurse manager doesn't have to figure it out, or the CNO. It's done in the background with data, which is really the key to lightening the workload on your leadership team. All right. So let's talk a little bit about the early success. So you're seeing some results here. This was done on four units. We started it in, I want to say, October. We measured it for a 3-month period, and these are the results just for that 4-unit for 3 months. And what you can see here is we hired that gig layer. We hired 50 people within that gig layer in 3 months. Well, no, so where did they come from, right? So that's important. So we did have a lot of internal strife over everybody's going to move to the gig workforce if you release it. There's no requirements. It is an incentive rate of pay on every shift. Here's the thing, guys, we pay no benefits on this. So if you need benefits, then you are staying in our core coworker. If you like working on one unit, you are definitely staying in that core coworker. And there are other benefits that we offer just besides the standard for our coworkers that would make them want to stay in that core coworker lane. We had 11 of them were new to the organization. 11 of them we call boomerang rehires. There was a break in service, likely during COVID. Most of them went to travel, but they came back to us. And there were 11 that came back in that manner because they liked this flexible workforce so much. And then we rehired some when they heard about it. They were gone from us for greater than 6 months. We were hired 13 in that category. And there were 35 that transferred from other roles in the hospital. But when you consider the benefits we were paying on top of it and the incentives plus the base rate for the gig workforce, they're pretty equal in the payout. It's just that they select how they get their money. And it does offer them increased flexibility. But if they want to make more money, they're going to pick up some of those hard to fill shifts. So it's interesting that 11 of those 35 transfers were planning to leave the organization to take external travel agency roles. So we did retain those 11 out of those 35 transfers were directly from saving people from leaving. So I think we don't even know who's planning on leaving us. So offering this flexibility helps you increase, maybe not core, but it helps you increase fill rate. So let's talk today's success. So we launched this back in October on 4 units. We launched a whole North Central go live in April. And on May 27th, we launched it across the entire organization. And so since May 27th, we've hired and oriented 458 gig workers. 93 were new to the organization. We rehired 220, and 145 were transferred from other roles within the hospital. And that's your external agency as well coming back into the hospital, into that layer. And so you can see how many were coming in. I also need to share with you, we to date have 1,800 applications out there. So we are still, although we've only hired and oriented 458, we have 1,800 that we had to sift through. So we're still in the process of sifting through them carefully to make sure they meet the minimum qualifications for experience and for role, as well as that mercy and talent fit, and then getting the competencies on board to make sure that we don't lose any quality with hiring this layer of the workforce. So we still have a lot left to go, but we've never had 1,800 applicants, I would say, at least as long as I've been here for 2 years. So this is pretty exciting. We are continuing to onboard and hire. All right, so let's take a look at where we are with some of the other metrics that are going to be important for you to understand. So we're talking about the number of shifts claimed, right, in the application. the number of unique users claiming those shifts, and then the amount of engagement. And you can see at the top, we've had a total across the ministry of almost 17,000 shifts claimed. We have over 3,000 ministry total users with a ministry user engagement rate of 527%. So not only are our internal coworkers loving the app, but our external coworkers are feeding into that fill rate. So, you know, I did list out some of our hospitals, our bigger hospitals here, so you can see what the breakdown is by hospital. And our smaller hospitals obviously have less claim, right? They have less needs, they have less claim. But it's pretty fantastic when you take a look at what our shifts look like that were being claimed. Just if we had regional flow pool or our internal Mercy coworkers, we wouldn't be nearly this high. So we are extremely excited about this. I did want to spend a little time today just highlighting for our leaders on the call where we're moving in terms of metrics. So before we launched this flexible workforce layer, all of our internal nursing leaders were focused on core, you know, getting to core. How are we going to get to core? While we're still focusing on it, we've lowered our goal rate on core from 90% to 80% at this point. So we can allow that flexible nursing workforce layer to fill in the rest. And that's where fill rate comes in. So while core was our gold standard, we're now starting to flip to fill rate as the primary metric that we're following to make sure that we're seeing the outcomes we want. And the fill rate definition we're using is staffed hours divided by patient demand hours calculated in the Smart Square tool to give us our fill rate percentage. So I'm watching every day, we have it in a dashboard, it's automated, that shows us what the fill rate is and where we're headed. It also monitors Mercy shifts, gig rate. It manages a bunch of different metrics that we'll talk about, but the very top level metric is that fill rate. It's remained constant at about 83 to 84% across the ministry for fill rate, while reducing agency utilization and rate. So what we found was the gig flexible workforce was very attractive to external agency that were working with us to come down and take a gig position with us. And so we are reducing, you can see, I didn't give numbers. I didn't want to share numbers in this presentation, the actual money amount, but I do want you to notice that we've been up and we've been down with agency and we're heading back to baseline. The only way we could have done that and keep our fill rate the same was to have this flexible workforce layer. So, all right, so let's take a look at what it's doing to other metrics. So in the beginning, we outlined for you, Dani outlined for you what we were going to talk about as far as metrics, which are very important. So fill rate, key for the number of hours worked. But then let's talk a little bit about the costs to having that 83 or 84% fill rate. And so you can see where we were, and this is labor cost per equivalent patient day. And we call it per equivalent patient day because I'm monitoring other units of service like emergency department, ORs, that type of thing. So unless I have it rolled up into a per equivalent patient day, I can't compare. So for most of you out there, it's probably labor cost per unit of service. And so when you take a look at where we were, now I want you to also understand we're in the height of the pandemic here. So we don't normally run these kind of rates, but when you add in what the labor costs are, and that's all types of labor costs, whether it's agency, overtime, gig, float pool, core, that's what it cost us per unit of service, right? $731 roughly, right? We have seen reductions. We were down a little bit. We started to come down. Don't forget, in this time frame here, we also launched a couple of our hospitals that were helping bring it down. But the ministry go live on May 27th, right here on this line, you can see we are taking drastic reductions. And I will tell you, I just looked at the last pay period data. We're down some more over out in here. So we continue to use that flexible workforce layer balanced with the needs of our core. We never want to forget those tried, trusted, and true Mercy nurses who've been with us. Combining that to make an overall strategy, we're starting to see some really nice decreases in cost per patient day. This is our highest level metric on the finance side. Now, if you drop down one more time, you're going to see that we're measuring our average hourly rate, again, for all sources of labor combined. And so same time frames, but you can see we were at $49.24. Here we started with a couple of pilot units in the North Central region. And here you can see was our ministry go live. And we are continuing to work down that trend. And so many would say, doesn't the gig workforce cost you more than balancing core? It's not about balancing core base rates against the gig incentivized workforce. It's about balancing all three layers to overall get you the most amount of fill rate with the lowest cost of labor. It's kind of like mixing skill mix on a really large level with all of your workforce layers. The other work that we did in here was balancing our skill mix. But I can tell you the gig workforce today is only active in that RN, LPN category. We haven't quite gone there with techs yet. So, all right, I am going to talk a little bit about how we accomplish this. So I will tell you, this has not been, if anybody tries to sell you that this has been an easy transformation, it is not. If anybody has tried to launch redesigning any type of workflow or workforce combined with all the processes that go along with managing people's time and money, which is the two no-nos to touch. We're touching them both at the same time here. And then balancing the needs of core coworkers with other incentivized coworkers, and then layering on a technology approach to make it easier. This has been the biggest transformation that Mercy has done. And, you know, most of you that have done any type of change work, we know that most transformations fail. When you look at the research, 70% of complex, large-scale change programs, number one, don't reach their stated goals. And if they do, the sustainability factor is hard. So where does the technology role come in? Why did we partner with Trusted? The two competitive advantages I can see to this is having that Mercy Works on-demand platform, the mobile app that works not only for that flexible gig workforce layer, but it works for our core coworkers as well, has really balanced the tide with adding technology in, right? Pain versus gain. And it is a little painful in the beginning, but at the end of the day, what you're getting on the other side to hardwire your vision and strategy on labor workforce into an automated fashion that makes it easier to deploy has really been gold for us. Sustaining that transformation has required a major reset, not only in behaviors, but the mindsets of our leaders. And, you know, I'd be lying to you if I said today, everybody's 100% on board and marching in the right direction. It takes some time and proof, and we've only been up since May 27th. But I will tell you, everybody's sticking with the strategy, and the results are showing up. So we are on the path. Everybody's going to get there for sure. But it really takes a strong leadership presence, strong stakeholders, and our leadership team at Mercy chose to invest in a change management office to ensure an appropriate focus on the human side of change, the process side of change, and we have incorporated in the technology side of change that was necessary to make this happen. So we have a chief organizational effectiveness officer. She came from outside of healthcare, which I love because she doesn't have any of the biases of what healthcare can and can't do. She's been my partner along by my side 100% of the time. The other thing I want to mention is I have a fantastic nursing leadership team at the ministry level that is 100% on board. And the way I structure it at the ministry level, I have an executive director of nursing practice, which is involved in this to make sure the quality outcomes stay up. And I have an executive director of nursing operations that has been managing by our chief organizational effectiveness officer side the entire time. The other things that have made this a huge success on the change side is we have partners in organizational effectiveness that have led through communication, leadership, as well as some of the education that was needed to roll this out. We've got a talent development side in Mercy that has been key to making sure that we stay true to selecting nurses that are key. And we've had some clinical and technical education leaders. We do have a vice president over nursing, really education that has led some of those onboarding and orientation requirements that have made it key. So it's been very important, and I would be remiss if I didn't tell you about how we manage this internally as a nursing team. So I've got a gentleman that's an executive director who manages healthcare change and optimization. He is a Lean Six Sigma expert, excellent facilitation skills, and he managed current state, future state, and gaps for us. And then we went from there, and we had a fantastic team working on this. So I didn't want to forget to kind of message how we got it done. So Works has supported our ability to function in a dynamic way. We are moving talent around to meet our needs, and we are using it to execute on our workforce layer vision. And so I can't get behind this enough, the way that technology has been able to move us quicker in the right direction. We've seen over an 11% reduction in premium spend, on our way to even more. We've seen a 25% reduction in our workforce operation headcount to where we're moving, and we're not done, and a 33% increase in incentive shift participation. So on all fronts, we are firing towards increasing fill rate at a lower cost for labor. So recommended for transformations, I think I just went over it. This is a fantastic slide, but I really gave you the secret sauce for what it takes to transform our organization. I did want to leave a couple tips. So it is overwhelming to think about this. I gave you our vision and strategy, the what, the how, the results. But there are a couple things you can do to speed to adoption and realization of the outcomes that you want in your health system. Number one is really, you've got to assess technical readiness to be able to scale rapidly from the pilot to ministry. You really can't roll something out like this slow, because it does affect your entire workforce. You have to have operational readiness, which I cannot stress enough, which includes system-wide CNO alignment on incentives, the role definitions in the layers, the gig hiring and how you're going to accomplish that, as well as onboarding. So there's a lot of upfront work before you release technology in, but technology can help you think about this in a way so you can be sustainable. So I would have a technology strategy in mind before you start heading down this, so you can design all of this with the technology enablement. Leader readiness at all levels. We've got to be able to express, model, and reinforce the changes with our coworkers. The largest impacts on your core coworkers, because they don't understand why you're adding in a new labor force. And the rationale, of course, is more hands at the bedside. I mean, 100% trying to help them reduce their workload. And the number one reason people leave you at this point is because the workload's too high. So it's a retention strategy built straight in there. And coworker readiness, right? They have to understand when they move to an app, what's changing for them. Even though it's a better experience, without that understanding, they will still struggle to get on board. And why we only rolled it out first to RNs and LPNs, right? Because we wanted to get our sea legs going before we introduced other forms of labor. But I actually can see this rolling out even far past nursing to a total workforce redesign and transformation. I always say, if you can take in the complexities of nursing, you can certainly address the other areas of need in workforce today. So, all right, what is needed? What kind of new thinking is required to really transform that staffing grid? Number one, you've got to rethink the 12-hour shift. And so one thing I didn't say during this presentation is, while we still schedule in blocks that resemble shifts, in order to have that flexible model for that part-time flex and other things, we're really talking about scheduling according to hours, not shifts. And that's a complete mind shift that has to occur for you to be able to take advantage of this 100%. Number two, recognizing that compensation goes beyond pay. So why do I say that? Because for our core coworkers, right, there's a cost of benefits. There's other things that they get that the gig worker does not get, or the other layers don't get. So when I talk about gig, I'm really talking about a regional strategy. When I talk about internal and external agency, I'm talking about a ministry-wide strategy. So making those kind of distinctions and knowing where you're heading is really key. So our core coworkers get, benefits that add up to money that the other layers don't. So having a strategy around showing total compensation has been key for our core coworkers. Take a personalized approach to staffing. You have to understand what that app is giving you, driving towards. It allows the flexibility of that personalized approach by unit that's held together to the entire philosophy through a technology enablement. And the last thing I want to say is enable movement within the hospital. So we're able to shift staffing resources easily with the gig coworker, the regional flow pool, because the money, the incentives, and the need comes through on an app. So that has really driven a good bit of our results. All right, Dani, I'm going to hand it back to you. I have talked a ton, but I want to hear from everybody else out there.
Yeah. Well, thank you, Dr. Rocchio. There's been questions just flying in. And so I'm just going to jump right into it, and they're going to hear more of your insight and wisdom around this. One in particular that's been trending in the chat box is, we know change is hard, and you alluded to that, but a lot of people wanted to know if you had any issues with your frontline nurses being unwilling to download the app or work in the app.
None. This is how I know the app. So this is how I know that the app is actually the secret sauce. And so we did go out to the literature, Dani, and you'll love this being a DNP. We did go out to the literature to make sure we weren't going to have problems with this. My team did a complete literature search on multi-generational workforce with technology and staffing. And it did show that all generations are willing to pick it up if it's easier, it's personalized, and it's not hard to navigate. So, when we designed this, right, Trusted designed this, they designed it to be those things according to the literature. They took that feedback, and that app was designed. And there's still more things planned to make it easier, but we have 0 people that didn't download the app, because guess what? We also said, you're never going into Smart Square again to be able to pick up an incentivized shift. You have got to have the app. So we made it really hard to do the wrong thing, but really easy to do the right thing. And nobody's had any difficulty. It's a link that's pushed to them. They download the app. They're ready to go as long as they're credentialed to be in Mercy. So no, we've had 0 problem. That has not been our problem.
That's great. Thank you for clarifying that. Some other questions regarding how are you advertising your program? You mentioned the 1,800 candidates. That's phenomenal. And have you seen the impact on your nurse retention and recruitment metrics because of it?
So yes, we have seen a really good, we're still too early to see the impact on retention. I'm just, it's only been live for 6 weeks, 7 weeks, I don't know. Whatever, it's been live since May 27th. So no, we have not seen anything on the retention side. We have seen it on the recruitment side, though. So we are starting to uptick. We're starting to decrease our days to fill and fill more jobs than we're posting. And that's that flip, because we were posting more than we were filling throughout the whole pandemic. And so, or even before the pandemic, actually, we were still upside down, but we are starting to fill more. And so as we get more, when do I expect to see retention kick in? When we hit so I'm showing you an 83 to 84% fill rate across the system. When I can comfortably say, and I can see it by unit, I can see fill rate by unit, when I imagine when everybody hits an 80% fill rate across the board, you're going to start to see retention move. That's my prediction. That's what I would say to that. So we're on our way, but we're not quite there on the retention side yet.
That's great. Thank you. Additionally, a lot of people want to know, how did you establish your KPIs for this initiative? And was there any pushback when you were setting metrics to show success with how you transformed the flexible workforce programs and use of the Trusted app?
So we were lucky enough, even before we engaged in this, to have a fantastic labor stewardship dashboard for nursing. So we were already used to showing labor per equivalent patient day, average hourly rate, productivity, core, skill mix. I can even show you skill mix across. So we already had that up and running, and it was a ministry-wide mobile BI powered dashboard. So it's also on their phones. So that's the other great thing. Our managers can see what it's doing to their cost of labor on their phone. But that was already set up, and it's set up at the ministry level. It's set up at a regional level. It's set up at a hospital level, and it's set up at a unit level. So each of my CNOs was used to going in to look at their individual hospital, and they could see all these metrics by all of their units. So they have a really great tool to be able to measure themselves. So I got no pushback. Where we had a little bit of an internal debate, but we have it straightened out now, was around core and fill rate, right? Like, what's the leading metric? Well, if you're going to embrace a flexible workforce model, you are going to have to push fill rate to the top of your bucket to manage, right? Because you can tolerate a little bit lower core if you have to, if you can fill in the demand hours with that flexible workforce. So no, we didn't get any pushback, but I will tell you, Need is my executive director of operations. She really had to work alongside the nursing leaders to put out what the KPIs are in a very consolidated format. We measure them every pay period at the ministry level. We have a ministry-wide meeting. We are looking at metrics, and I have a leader from one of my communities that's leading the labor stewardship group. So I've got a group that meets off to the side from every single hospital that's looking at this the whole time in case we need to change strategy or look at anything different. So no, I didn't get any pushback, but that changing to that fill rate being the leading metric was, we really had to work around that definition a little bit.
Yeah, I love your approach too, of hearing you say, like, we're looking at it, we can trend it, we can adapt to it. So being very agile as a nurse leader is really powerful. We have some more questions also around just who's using the Trusted app. Are you using this in all specialties, such as ICU, in the ER, and across your whole workforce? Outside of course, you mentioned the RN, LPN category, but the specialty of nurses. Yes,
we are. We're using it across every single layer that's using SmartSquare, if that makes sense, on the nursing side. So yes, 100%, because we programmed the technology that's the only way you can pick up incentivized shifts. So yes, it's live everywhere. I should count up the number of units that are live across we have 45 hospitals, but how many units is that? I don't know.
I would imagine it's a lot.
It's a lot. It's a lot.
Also, the gig workforce was really a hot topic in the questions. People are wanting to know, are you finding anything unique about the demographic of who's interested in the gig work options, such as age or, just anything that you can share that may be insightful?
Yeah, well, number one, it is people that either don't need or don't want benefits. So the requirement is you have to have at least a year experience as a nurse before. You can't just get thrown into this gig role. It's, it's a lot of movement and change. And so we do require that you have a year experience before you can apply to this role. But yes, we are finding that once they have that year experience, so don't forget, you don't get any health care benefits. So those that are maybe still on their parents, right? So the younger workforce that are still on their parents' insurance, or have a spouse that carries the insurance, we're finding that's highly valuable to them. And other than that, it's a good mix, right? It's about meeting what they need and can they get it, right? There's like a decision tree if you decide you want to go into this. If you need full-time benefits, if you want any benefits, you're not going this route, right? But if you want that flexibility, you want an increased rate of pay in lieu of benefits, we're watching that workforce towards this.
It's great. Do you pay for any of your gig staff credentials, such as your ACLS, BLS, NPR? How is that positioned within Mercy?
No. So don't forget, we hold true to the workforce layer definition. They get zero benefits. The only thing they interact with us for are just those core competencies. But they have to, in our Mercy Works on Demand platform, they have to have their nursing license in there. They're responsible for keeping up their profile to make sure that that their license is active, that they have any certifications that are required for their particular job. Nope. They handle all that.
That's great. And one last question about the gig, and then we'll wrap it up. Just curiosity about 12-hour shifts. Are you offering more than 12-hour shifts? Can they pick up a variety of different shifts as a gig workforce through the Trusted app?
Yes. Anything that the manager lists on their schedule that isn't filled by an internal Mercy coworker can absolutely go across and be picked up by gig. Now, we are finding that the gig do like the 12-hour shifts, right, for whatever reason. And we've got plenty of them, so it's not like we're hurting. But yes, any amount of hours of shift can go across as long as it's in our staffing and scheduling system and it's unfilled. We have like mid-shift type things, like in an ED, like 11 to 11 or that type of, setup in 12-hour shifts. And yes, totally handled by the app. Everything's completely app-based. The other thing I'll say is that might be important is our internal coworkers are offered the opportunity to pick up incentive shifts before we push it out to the gig. So it does give our core coworkers the benefit of being able to pick up the shifts first. So it's kind of priority status, right? And then it's pushed out to our gig coworkers to pick up. So that is a benefit to our core.
That's wonderful. Well, I really appreciate, Dr. Rocchio, your innovation, your thought leadership in this space, and you're willing to really tackle this problem in a tough time. I'm excited to see the results continue and how this transformation will continue to set Mercy apart. So thank you for everything that you shared here. I'm going to hand this back over to Jacob from Becker's.
Fantastic. Well, that is all the time that we have for today. I want to thank Betty and Dani for an excellent presentation and Trusted Health for sponsoring today's webinar. To learn more about the future of nursing, please check out the resources section on your webinar console and fill out the post-webinar survey. On behalf of all of us here at Becker's, thank you so much for joining us today, and we hope you have a wonderful afternoon.